talking a little bit about plastic surgery topics, and I get to answer your questions. Thank you so much for joining. Today we're going to have a special topic about energy devices with liposuction, because I played a video on TikTok talking about Vaser, and everybody was asking, what's Vaser? What is that? Why do I use one or the other? So let's just go over energy devices so you can make an informed decision of what suits you the best depending on what you're looking for, okay? But to start talking about energy devices, I have to talk just a little bit about liposuction, because I do believe most of these energy devices are more powerful when you're combining it with liposuction or a surgical excisional procedure. By themselves, the amount of skin retraction that they get, it's not as drastic, but with the combination of liposuction and the energy device, that's when we really get to see a dramatic improvement in the contouring of the area that we're treating. So what is liposuction? Liposuction is basically a cannula that we are suctioning fat. That's why it's called lipo. Lipo stands for fat. Suction, we're suctioning fat. So we're removing the fat that is in the subcutaneous space. Our body has different layers throughout our body. We have the skin, we have muscles, and in between, that's where the subcutaneous fat lies. Depending on the area of the body, there are areas that have more subcutaneous fat, less subcutaneous fat. So there are areas that are more prone to have liposuction. For example, the abdomen, which is the most common area that we do liposuction on. The back, the thighs, the arms, the chin. Those are basically the most common areas we do liposuction on, because those are the ones that harvest or harbor the majority of the subcutaneous fat in our bodies. And because we can powerfully combine this with contouring the torso. So what's the difference between liposuction and liposculpture? People talk about liposculpture. Liposculpture, basically we're removing the fat and sculpturing the body. So whenever I'm doing liposuction, I am doing a liposculpture, because it's not only the removal of fat, we are sculpting your body. So the artistry behind liposuction is very important. And that's why it's so important to go to a board-certified surgeon, but also that someone has good experience with liposuction and doesn't only see just removing fat in a blob and that's it, but contouring it and making it transcend and kind of flow from one area to the other, conserving the anatomical features and giving you that sculpturing that it's so important. But what is the limitation of liposuction? Is that we're suctioning the fat, but what happens with the skin? We're not excising skin, so we're relying on your body to have that skin retract so you can see the results. Because you can empty the fat all you want, but if the skin doesn't retract, so what do I mean by retract? Suck back, attach to the muscle, flatten, right? So if you don't see that, you're not going to see a beautiful result from the liposuction. So who's the perfect candidate for liposuction? A patient that is close to their ideal body weight, that hasn't had drastic fluctuations in weight, because when we drastically change weight, that skin has been stretched and collapsed, and the ability for the skin to retract, that elasticity of the skin is lost. Other things, younger patients. Why? Because when we're younger, the skin has more collagen and elastin, and the ability for the skin to retract is better. When we age, the ability of the skin to retract is less. And we see that with pregnancies. If you have a 20-year-old that had a pregnancy, most of the time they bounce back and the belly flattens. But when you have a pregnancy in your 40s, it's not the same, right? It's because the aging changes in the skin change the ability of the skin to retract and bounce back. So what we can do to optimize that ability of the skin to retract, that's when the energy devices came in. It's like, but we created that beautiful sculpturing in the operating room, but once the swelling went down, once the patient is standing, because yeah, everybody looks great laying down, but what happens when gravity comes and we see that skin droop, right? Then the results are not as beautiful, as dramatic, as drastic. So what can we do for the patients that are not yet at a skin excisional, they don't have an amount of skin that they need a tummy tuck or a skin excisional, But there still needs some help with the skin elasticity. So that's when the energy devices kick in. And I think they're a great thing to add to your liposculpture or liposuction procedure to try to get that skin to retract. Because again, if the skin doesn't retract, you're not going to see that drastic and dramatic result that you're looking for. So the skin, we need to treat the fat with removing it, but we need to treat the skin, okay? So energy devices, there are many in the market. These are the ones that I have, that I use at Pure, that I love, and that's why I'm going to explain this to you, because they're the ones that I feel that work the best, and the ones that I use every day. So I'm not talking what the companies say, I'm talking about my experience with them and what areas I think each of them work the best, okay? Again, it's not a one card is for everybody, but I think the combination of things sometimes is helpful, and also depending on the area that we're treating, I sometimes prefer one or the other, okay? So I'll go over what each of them are, and then what areas I usually prefer to use one or the other, okay? So Vaser liposuctions stands for ultrasound energy, okay? So basically, before going into them, the basic rationale behind energy devices is to put an amount of energy enough for the body to create an inflammatory response. And when our bodies heal, basically if you get a cut in your body, the natural inflammatory response of the body is to contract, okay? That's the natural. We have a hole, we need to make it smaller. That's the natural response of the body to healing. Part of the response is obviously coagulating, so the platelets go in, let's stop the bleeding, but then let's close the hole. So a lot of cells and inflammatory markers, proteins, everybody goes to that area to try to make that hole smaller. So the point of an energy device is to administer a certain amount of energy to the skin and subcutaneous tissue that starts to elicit an inflammatory response that can actually contract the skin without causing fibrosis, without causing scarring on the outside, okay? So that's the deal. We want enough energy to create that skin elasticity retraction. Also, increase the collagen formation, because that's what basically our bodies do. When we say, and we hear it say it all the time, we want to stimulate collagen formation. That's what the wound healing response of our body is. The contraction is bringing collagen in. Collagen and fibroblasts create that scar, okay? So when we are giving that amount of energy, enough for our bodies to create that inflammatory response, is to create collagen, which creates collagen, elastin, and brings the skin tighter, okay? That's the overall concept, no matter what energy, no matter what device we're using. That's the overall kind of rationale behind these devices, okay? So Vaser is one of the devices that we have available. I've been using Vaser for years now. I used it in training, and then we got it here at Pure, I think almost 2 years ago, and we've been using it every day, basically. We use Vaser every day. I'm not saying that I use Vaser in every single case, but most of the time we have Vaser used in the operating room, either by me, by Dr. Wigriff, or Dr. Earl. It is a device that if we use often, it's because we like it, right? If we don't like it, we wouldn't be using it so much, because we don't get any money from the company. It's not because I'm using the device, I get money from them. No, we use it because we think it works, okay? And we invest in our patients to give you guys the best results that we can, okay? So it's ultrasound energy. What does that mean? Basically, the energy devices come in different energy sources. The energy source that it's giving, it's what's causing that inflammatory response. So Vaser's ultrasound energy, it is not the same as the ultrasound we use in BBL. There is a difference between the ultrasound energy and the ultrasound imaging, okay? I don't want you guys to get confused between this, because sometimes I say I don't use Vaser in every single BBL, and you're like, so you're saying you don't use ultrasound in every BBL? No, I use ultrasound imaging in 100% of my BBLs because that's imaging, the same that we use to see the babies when they're in the belly, okay? It's imaging, seeing, okay? So I am using ultrasound imaging to see where I'm injecting the fat in every single BBL, but Vaser is an add-on. It's ultrasound energy. So how does it work? Vaser, and this is from the Vaser website, okay? It has been shown to have less pain, less blood loss, less bruising, less blood loss goes to less bruising, and better skin retraction. So basically, this is how it works. Basically, you have the subcutaneous fat, the little cannula goes in. The first step is to infiltrate fluid, okay? We want to expand the skin with tumescent solution. Once that fluid is in and the fat is expanded, that's when the ultrasound device comes in. Why? Because the water makes the ultrasound energy expand so it reaches a larger area, okay? So here again, you see this is the Vaser cannula. It's already expanded with fluid, and you see that you go in with this and there is breakage of fat. So it kind of liquefies the fat, it breaks it, okay? So you see here how it kind of vibrates and administers that ultrasound energy, and it's also coagulating the little blood vessels with that energy. And after that is when you come with the liposuction cannula and you suction all that liquefied fat. So that's Vaser, okay? So it's basically all those steps. Why it has less bruising? Because the ultrasound energy coagulates the blood. The energy is administered at the subcutaneous level. Vaser is at the subcutaneous level, okay? So it acts and that's why it has that added benefit of decreased blood loss, decreased bruising, and that's why I think it is so good when we're combining it with liposuction, Lipo 360, BBL procedures. I think it's great because it has not only the benefit of skin retraction, but it has the benefit of less blood loss and less pain. So I think it's a great device, okay? Let's go to BodyTite and FaceTite. So basically, BodyTite, it's a little different, okay? BodyTite, it has a little cannula. Let me get rid of that. It has a little small cannula, and this little darker cannula is the one that goes inside of the body, okay? So with BodyTite, you do the first same step, which is adding the tumescent fluid, okay? Expand all that fat. You do the liposuction first. You do liposuction so it doesn't have that added benefit of decreasing the blood loss, but it kind of sandwiches. This little cannula goes inside of the body through the incision, and all of this is going to be outside. And I'm going to show you, this picture is from FaceTite, which is same as BodyTite, just shorter because it's used in the face, okay? The BodyTite is used in the body. So BodyTite, you use it in the abdomen, back, arms, thighs, and FaceTite is just a smaller one for the face. So you can see here, this part, which is this part of the device, it's outside. So the energy, it's being administered in between these two. You kind of sandwich the skin between the inner cannula and the outside, which is administering the radiofrequency energy. So it is very good for areas where the skin is very thin. I love using FaceTite, BodyTite in the chin, in the arms, in the thighs, because it's kind of sandwiching that skin that it's so thin, and it acts in the subdermal. So we have the skin, we have the subcutaneous fat, but that layer that is very thin, it's called the dermis. It's the deeper layer of the skin. And just the most superficial part of the subcu, which is the subdermal area, it's where we want that collagen to be forming and that skin to be retracting. So this is great for those areas. And like you've seen, it is a different layer than the Vaser. The Vaser acts deeper. The Vaser acts in the subcutaneous space, okay? So this one is the FaceTite. You see the chin area. And the other great thing about the BodyTite is that it gives you a temperature of how much temperature you're getting, and it has different parameters depending on the area that we're doing. But it has different temperatures depending on the area that you're treating, and the machine is gonna tell you when you're reaching the actual temperature you want. So it's not of a time, or it's not of a feel, it's an actual measuring temperature. So once you reach that temperature that you know it's going to elicit that retraction, then you stop, okay? So I do recommend it, like chin, the areas very thin, the arms, the thighs,